Kayla Decker, and I will be presenting the cardiac condition hypertension. What is hypertension? Hypertension is a medical term used for high blood pressure. It's a common cardiac condition. The definition of hypertension is the persistent high force of blood against the artery walls. There are two stages to hypertension. Stage 1 is classified as the systolic number being between 130 and 139, and the diastolic number between 80 to 90. In stage 2, hypertension is classified as systolic greater than 140 and diastolic greater than 90. In a hypertensive emergency or crisis is when the blood pressure reaches greater than 180 over 120 and requires immediate medical attention. Hypertension also has another nickname called the silent killer. That is because over years and years, this type of force in your cardiovascular system causes irreversible damage without having any symptoms until it's too late. Again, in the early stages, there usually are no symptoms. In the late stages, a person could experience angina, which is chest pain, headaches, shortness of breath, swelling of the extremities, dizziness, urinating less than usual. Some serious complications of hypertension include stroke, heart attack, vision loss, and chronic kidney disease leading to dialysis. Hypertension on the body can cause structural damage. Within the cardiovascular system, the heart is affected. As seen on the picture on the left, we have an anatomical picture of a heart. On the left side is a normal size heart, and on the right, we have what's called left ventricular hypertrophy. This is the thickening of the heart muscle in the left ventricle. Increased blood pressure causes increased peripheral vascular resistance, the force that resists blood flow. To adapt, the myocardium begins to thicken, aka become hypertrophic, narrowing the ventricle's capacity to fill during diastole, therefore over time leading to heart failure. Next, the arteries. The innermost layer of the arteries is composed of delicate epithelium tissue. The force of high blood pressure constantly on the walls of the arteries causes shearing, tearing, resulting in scarring. This makes it easier for plaque to stick. And then in the respiratory system, this affects the alveoli. If left-sided heart failure occurs, blood begins to back up into the lungs. Eventually, this high pressure in the pulmonary arteries causes the blood vessels around the alveoli to harden and thicken, not only reducing blood flow, but reducing the amount of oxygen carried to the rest of the body. There are some ways to manage high blood pressure. Some lifestyle changes that you can make. You could stop smoking and limit alcohol. Decrease salt intake, avoid like frozen meals, canned foods, adding extra salt while cooking, eating at home. You can increase exercise. Lack of exercise causes weight gain. The more weight that is on your body, usually the higher your blood pressure is, and have a higher resting heart rate as well. You can also reduce stress. When the body is in fight or flight, blood pressure will ultimately increase. Right now, there are multiple medications on the market available to treat high blood pressure. Here are a few, but multiple people take more than one if prescribed. This list is only a few, but not limited to. We have diuretics. An example is Lasix. This decreases the amount of fluid intravascularly. We have ACE inhibitors. Example is lisinopril. This lowers blood pressure and reduces the workload on your heart. And then we have calcium channel blockers. An example is amlodipine. Calcium channel blockers stop the influx of calcium ions into the muscle cells of the heart and blood vessels. And then lastly, there's some environmental factors that could be used to limit the progression of hypertension. For example, you can limit excessive noise. Chronic noise triggers the autonomic nervous system fight or flight. Next, avoid extreme cold and heat. Both can spike blood pressure. Avoid secondhand smoke. In addition to smoking in general, smoking can cause arteriosclerosis. It speeds up that process. And that is hypertension, a chronic heart condition that affects many people, not only in the United States, but across the world. Thank you.